Welcome to Nursing with Professor B. My name is Brigitte. I have a master's degree in nursing education. I'm also a family nurse practitioner. In today's video, I will be going over non-therapeutic communication techniques. This video is primarily geared towards the student that is in mental health nursing, that is studying for those types of exams and for clinicals, what to say, what not to say. It can be very scary at first. I already did a video on therapeutic communication techniques, so make sure you check that video out. I'll put a link up top. But also, it's important to know what to say, but it's also important to know what not to say. So mental health nursing, the answers can be very tricky. If you know the playbook and what to look for, then I can help you succeed. All right, before we get started, make sure you hit the like button, make sure that you subscribe, and make sure you turn on that notification bell. Let's go. A lot of times when you begin in mental health nursing, there's a lot of fear, you're scared, you don't want to say the wrong thing to the clients. The most important thing that I can tell you, or the pearl of wisdom, other than putting aside your exam, but as long as when you are in the hospital with your patient on that unit, if you show them that you truly care about them, if you're kind, if you're compassionate, that at the end of the day matters more than what you say. And remember, a lot of times it's not what you say, it's how you say it. However, you need to pass mental health nursing. So let's give you some tools and tips and tricks so that when you get a question on an exam, you know how to answer it correctly. You know which answers to eliminate because you know, oh, that's non-therapeutic. We'll start with the non-therapeutic technique of giving advice. I also find that there are gender differences. A lot of times issues in relationships will arise. And remember, this is a generalization. Of course, there's exceptions for males and females. But in general, women like to talk about the problem because they're venting. It's an outlet for them. So they'll go home and they'll tell their boyfriend, their husband, and they'll say something like, oh man, this happened today and blah, 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 blah. And then the husband or the boyfriend will try to help. They'll try to offer some kind of a solution. And then the solution that they offer, normally the woman gets exasperated, or they're like, oh, that would never work. Like, I just want to talk and you're not listening to me. And then the male feels like, well, what do you want from me? So both parties end up frustrated because the woman just wanted to vent and the male is trying to help, but he's giving advice and it's unwarranted advice. That's not really what she wanted from him. She just wanted a listening ear. This isn't couples therapy, but what I tell sometimes my students if this happens in their relationship is to let the guy know what you need from them. Like, I just need you to listen right now and I don't need a solution. That way the guy knows that she just wants to be heard. And then what I tell the guys is it really does help a woman. Like for men, they feel like talking is pointless sometimes. Like nothing is resolved, nothing was fixed. What's the point of talking about it if we're not going to do something about it? So, but it does help your significant other to just be with them and be present. What it does, it assumes that the nurse knows best and the patient can't think for themselves. It fosters dependency. You want your client to be independent. You don't want them to always have to come to you to make every decision, because once they leave the unit, and remember, on a lot of times when you're interacting with these patients, they're going to be on a locked unit. They will be Baker acted if you're in Florida, or that's an involuntary hold anywhere else in the United States. Involuntary hold for 48 to 72 hours, unless they are deemed incompetent by a second opinion, and then they can stay longer. When they're out in the real world, they can't find Nurse Sally and say, hey, Sally, what do you think I should do about my boyfriend? Should I break up with him? So it doesn't allow the patient to problem solve. You want to foster independence, not dependence. And you also don't want to should a patient, like, you should do this or you should do that. It's very belittling to the patient. So for example, if you say something along the lines of, you should get out of this situation immediately, that's not right, okay? So that's an example of what not to do. An alternative to giving advice is to encourage problem solving. So you could say something along the lines of, what are the pros and cons of your situation? What are some actions you thought you might take? Or what are some actions you think you might take? Next, we have the non-therapeutic technique of minimizing feelings. And what it does, it shows that the nurse is unable to empathize with the patient. The patient's feelings or experiences are belittled, which can cause the patient to feel small or insignificant. So for example, if the patient says something along the lines of, "I wish I were dead," and the nurse responds with, "Everyone gets down in the dumps sometimes." And obviously I'm over exaggerating that so that you see how ridiculous that sounds. You also don't want to say, "I know what you feel. I know how you feel." You're minimizing their feelings. You don't know how someone feels because you are not in their shoes. Even if you've gone through a similar circumstance, you minimize their feelings or their experience by saying, "Oh, I've gone through that. You'll be okay." Because we are all different. We all react differently. I mean, look at the situation with COVID. Recently, most of my family is in Colombia, and there is a friend of the family, 30 years old, no pre-existing conditions, completely healthy, passed away with COVID. So just because you've had something happen to you, a divorce, a death, and someone else goes through a divorce or a death, you can't say, "Oh, yeah, I mean, when that happened to me," it's not about you when you're with them, it's about them. The number one thing with mental health nursing is empathy. You have to be empathic and you have to listen and you have to want to help. So if you are a highly empathic person, so if you have a high EQ, which is an emotional quotient, which I really wish we would teach in schools starting from elementary, because that is important, right? Being able to read people emotionally, their actions, their behaviors, their body language, their tone of voice, that is so important in mental health. And that's why I love mental health and I'm fascinated by it. It's my passion. So if that is you, there is a great need for empathic mental health nurses. And if that is you, then I urge you to consider mental health as a field for you, because many nurses are either scared to go into that profession, or they lack the empathy or the patience. An alternative to minimizing feelings might be empathize and explore. So acknowledge their feelings. You could say something along the lines of, "You must be feeling very upset. Are you thinking of hurting yourself?" Remember, anytime on a unit that a patient verbalizes suicidal ideation, you must take it seriously, you must contract for safety, and you must notify the psychiatrist. The non-therapeutic technique of false reassurance. What it does, it underrates a person's feelings and belittles their concerns. It may cause the patient to stop sharing feelings if the patient thinks they will be ridiculed or not taken seriously. Something that will look like false reassurance is some people respond as, someone broke up with you and they're like, "Time heals, there's plenty of fish in the sea, everything's gonna be fine." That's not, you want to empathize. Again, you want to empathize with the client and you don't want to give these platitudes. So what's an alternative? You could clarify. What specifically are you worried about, or what do you think could go wrong? The non-therapeutic technique of making value judgments. What it does, it prevents problem solving. It can make the patient feel guilty, angry, misunderstood, not supported, or anxious. So this, I'm going to put the link of the book. This is Varcolis, is where I got this example from. I'll put a link below, and I'll also include a link to a book that is very helpful when you're mental health. It's like a study guide. So the example in that book was like, "How come you still smoke when your wife has lung cancer?" I don't know. I can't imagine that someone would say this to a patient, but yeah, it's kind of savage. So an alternative is, "I noticed you're still smoking even though your wife has lung cancer. Is this a concern?" And again, this is straight from the book. This is called making an observation. I left this example because I probably wouldn't say this to a patient. I wouldn't even broach the fact that this man is smoking, or say something along the lines of like, "Have you ever considered smoking cessation?" But I left it in here because technically making an observation is a therapeutic communication technique. So if on an exam you have 4 answers that in your opinion don't sound right, but you know that this one is making value judgments, and you know that this one is making an observation, and they're telling you which is an example of therapeutic communication techniques. So even though I personally wouldn't say this, but the fact that this says, I notice you are still smoking, you're like, okay, well, that's considered a therapeutic communication technique, so I guess I'll go with that one, even though you don't like it that much. Which, again, I hear this all the time from students. As an adjunct, I don't make the exams, so I get a lot of feedback from them. They tell me like, oh, that exam was awful, the questions, blah, 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 blah. But I feel like if they read the questions carefully, a lot of times they can arrive at the right answer. All right, this is a huge one, a huge one. If you can grasp this concept, you will probably get at least 3 or 4 questions right. The non-therapeutic technique of asking why questions. I tell my students this all the time. If the answer choice is asking for a therapeutic communication technique and the answer has a why in it, if you see the word why, eliminate it. You're done. Don't even read the rest of it. Because what does why do? What it does, it implies criticism. It elicits a defensive response. So for example, why did you stop taking your medication? Well, because I felt like it, right? The patient might say that to you. Or why didn't you eat all your food? Well, because I didn't want to eat it. It tastes like crap. You know, they can get very defensive when you start with why questions. Instead, what you want to do is ask open-ended questions or use a broad opening. So for example, tell me some of the reasons that led up to you not taking your medications. This is a lot better because is there a legitimate reason why they're not taking their medications? Are the side effects atrocious and they're like, I can't deal with the side effects, I don't want to take my medication? Is it cost? Is it I can't afford to take my medication? So explore. You want to explore, ask open-ended questions, use broad openings to figure out what's going on. Non-therapeutic technique of excessive questioning. What it does, it results in patients not knowing which questions to answer and possibly being confused about what is being asked. It conveys a lack of respect and sensitivity to the patient's needs. So for example, if you're like, why did you leave your wife? Did you feel angry with her? What did she do to you? Are you going to get back together with her? A lot of times when you're in mental health nursing, you will have to do what's called an IPR, which is an interpersonal process recording. And you basically will talk to a patient and then you never write down stuff when you're there with them while you're in front of them because you don't want them to feel like a lab rat, like, oh, here I am analyzing you. But you go back, your instructor lets you off the unit and you do your best to write down the conversation you had. So a lot of times what students will want to do for their assignment is just ask a bunch of questions so that they can fill in the boxes. But remember, your patients are human beings and they know when you're trying to get something out of them or when you're interrogating them, they should not feel like you're interrogating them. So alternatives are tell me about the situation between you and your wife. The way to get a patient to open up to you is by showing a genuine interest, right? If they see that you truly care, they will just, I call it verbal vomit. Like they will tell you your life story. Oftentimes when I sit down with a client, I ask one question and they just, boom, they're off and they're just talking and they tell me their whole life story. And I don't have to say, well, why did this happen? What did you do with that? Blah, 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 blah. The non-therapeutic technique of giving approval or disapproval. Okay, this is a big one that trips up a lot of students because you think that showing approval is a good thing. And in everyday life, you can, and giving approval does lead to positive reinforcement. But when you are on a unit, you do not want to do this. Especially on an exam, giving approval or disapproval is not the right answer. It is not the right answer. If you see something like, I like your green shirt, it is not the right answer. What it does, it passes judgment. Whether you are saying something is good or bad, you are judging it. And it may lead, again, this needs to be capitalized, it may lead the patient to focus on pleasing the nurse or healthcare provider. It denies the patient the opportunity to change their mind. So for example, if you say something of, I'm proud of you for applying for that job. That was a great decision. You want patients to have an internal sense of self-efficacy and not to rely on external validation in order for them to feel good about themselves, because that can lead to a lot of codependency. So alternative for approval is making an observation. I noticed that you applied for that job. This has a end sentence, a period, and then this is here, but I noticed you made a decision. And remember, making observations, you notice. I noticed you did this. I noticed you did that. So the alternative also for giving approval is, I noticed you washed your hair. I noticed you made your bed, instead of saying, good job, you made your bed. I noticed you finished your breakfast, instead of saying, good job, you ate your breakfast. All right, so for giving disapproval, example of what not to do. You really should have shown up with for the medication group, or I disagree with that. Alternative, exploring. That's one point of view. How did you arrive at that conclusion? I can't tell you how many times I've taken students on the unit, and remember, it's about them. It's not about you. Let go of your ego. So I've taken students on the unit, and the student ends up talking more about their life versus the patient talking about their own life. That's like you going to see a therapist, and the therapist ends up talking the entire time about themselves and their accomplishments, and you're there to talk about your problems and your situation. Changing the subject, what it does, it may invalidate the patient's feelings and needs. Patient may feel alienated, isolated, and hopeless. So example, patient says, I'd like to die. And the nurse responds with, did you go to Alcoholics Anonymous like we discussed? Instead, you want to validate and explore. So the nurse would say something along the lines of, this sounds serious. Have you thought of harming yourself? So those are all of the non-therapeutic communication technique. If you want a free copy of this PowerPoint, email nursingwithprofessorb@gmail.com. I ask that you screenshot confirmation that you subscribe to my channel. I have student loans. You guys know the struggle. Help me pay off my student loans. So yes, good luck on your exam, and drop a comment below if these techniques helped you on your exam. I always love to hear from you guys. All right, bye. Thank you so much for watching. Make sure you hit the like button. Make sure you subscribe. Make sure you turn on that notification bell.